Welcome back to the Daily Dope. I am your host, Brand. And when I'm looking at updates for what's going on with the opioid epidemic, or whatever you want to call it, I follow this guy here, Travis Lupick. He's an author and activist. He's the guy that does the thing where they go out and raise awareness in different areas that are hard hit by the epidemic. And whenever I talk about the epidemic, there's always going to be somebody talking about how I'm just pushing the government propaganda along for you and trying to, you know, jump in on this hysteria or whatever. And that's really not the case. And I also don't throw opioid and anybody that uses opioids, I don't throw them under the bus or say that we should focus the enforcement on them at all ever. So basically, when I'm reporting on this stuff, and I give you the numbers like 72,000 people died from drug overdoses in the United States in 2017, I'm just telling you what the fucking CDC's reporting, all right? So sorry if you think that that's, fake news or whatever, but that's just that's what these guys say. All right. Now, am I the biggest fan of the CDC and their reporting styles and methodologies? Not really. But when they say something like 68% of them are due to opioids, I believe that. And when I see their numbers, I'm just going to say that, this might be reflective of, you know, not as what they are representing as much as what they say or exactly. And when you look at the methodology, you can make different cases for that. But these are the numbers, and they are going up. Why are they going up? Well, first of all, because nothing's being done about it at all. We just heard the Department of Justice talking about how they're going to start ramping up some of the stuff that Jeff Sessions was talking about and start cracking down and start telling doctors that they can only give so many opioids out, and they're going to warn people that opioids are dangerous now instead of, almost as if opioids are Schedule 1 all of a sudden, which they're not. They didn't change the schedule or nothing. It's just a matter of, a new way that they're going to try to criminalize and demonize people that take opioids, whether it be, your garden variety chronic pain sufferer that gets prescribed opioids that have all been getting cut off in recent years. You might be somebody or know somebody that has straight up gotten told by their doctor that they can no longer prescribe them the amount of opioids or whatever. And you got Florida making up new rules where you can only get so many opioids prescribed or whatever. Okay, what happened here? Sorry. I don't know if I can get out of this. It don't look like I can. Oh, there it goes. Cool. So another quick thing that Travis shared was this thing about how fentanyl deaths doubled in 10 of the problem states that have already had big numbers or whatever. And this also includes this crazy thing where they're analogs of fentanyl and other things like carfentanil, which is, I think it's, as someone said, it's 100 times stronger than fentanyl. I don't know. We might see that here in a minute. So what I'm talking about here isn't even all that, because I could make a story out of this if I wanted to, but I'm just going to use that as like a springboard to jump into what's going on in New York, because a lot of stuff is happening rapidly in New York. We remember the Cynthia Nixon campaign to challenge Governor Cuomo's reelection bid. And since she's came out strongly in favor of super liberal marijuana reforms in their laws, Cuomo has been forced to act on the issue and literally has acted on the issue. They called for some studies to be done and recommendations to be made, and those are in too. But we're going to start with this emergency rule that New York enacted which allows medical marijuana to be used as an opioid replacement. And this is by Kyle Yeager over at Marijuana Moment, who does great work. So if you can follow him, that would help you. You can follow him on Twitter like I do, and you can read his articles over on marijuanamoment.net, which is Tom Angel's awesome hookup. That's all I can really talk about. New York regulators are moving to allow patients who normally were prescribed opioids for any condition to use medical marijuana instead. That means people suffering from severe pain, opioid dependencies, or other maladies will now qualify to receive medical cannabis, the state Department of Health announced on Thursday. Quote, medical marijuana has been shown to be an effective treatment for pain that may also reduce the chance of opioid dependence, New York State Health Commissioner Dr. Howard Zucker said in a press release. Another interesting study, by the way, just a little side note. I don't have that pulled still, but I did see that there was another study. Oh, yeah, it was right here. Maybe not. Yeah, right here. There's another study that just came out by the American Journal of Public Health. It was published. Columbia University epidemiologist June Kim and her colleagues reported that fatally injured drivers are less likely to test positive for opioids in states that allow medical use of marijuana. So it's just another study showing harm reduction when it comes to medical marijuana. And I think, that's just another. So when you hear people like Chris Christie cast aside with his opioid commission, and he basically cast aside over 12,000 comments for marijuana about the opioid epidemic and how marijuana has been effective in helping, either because people are prescribed it or not prescribed it, but they use it for pain instead of getting prescribed opioids, and it has helped addicts to basically overcome addiction, which is two big deals. But Christie just brushed that shit right aside, said marijuana is dangerous and addictive and leads to more opioid deaths, which he said with absolutely no scientific backing. No, there hasn't even been any correlative studies or anything he could point to that would say that that's true. There's absolutely nothing in any of the government's literature, or anyone that makes claims about marijuana. No one ever actually has any study that says, yep, marijuana, that's what leads to opioid addiction. That's not a thing, man. That's on a personal level. If someone decides to move on from marijuana to another drug, that's something that an individual decides. It's not that the drug made you do it. You don't. Anyway, adding opioid replacement as a qualifying condition for medical marijuana offers providers another treatment option, which is a critical step in combating the deadly opioid epidemic affecting people across the state. And that was, again, the New York State Health Commissioner, Dr. Howard Zucker, talking about why they made this decision. Research has consistently demonstrated the ingredients in cannabis can treat various forms of pain, including neuropathic, acute, and chronic pain. Adding severe pain and opioid dependency to the list means that 13 health conditions now qualify patients for medical marijuana in New York. Currently, more than 62,000 patients and about 1,700 practitioners are registered under the state's medical cannabis program, according to the release. Numerous studies have shown that given the option of using cannabis as an alternative to prescription opioids, pain patients would opt for the former. Unlike opioids, marijuana does not come with the same risk of dependency, and nobody has fatally overdosed on the plant, ever, period. There's also evidence that states that provide legal access to marijuana experience significantly fewer opioid-related hospitalizations. A study released this week found that medical marijuana laws were associated with almost 30% reduction in the amount of Schedule III opioids prescribed to Medicaid enrollees, which is a flashback to about a year ago when that study came out by another group of people that did the same study. And they were talking about the amount of Schedule 2 and 3 opioids. The New York Department of Health first announced its plans to add severe pain and opioid dependency to the list of qualifying conditions last month, and is now releasing the emergency regulations to implement the decision. New York Senator George Amendor Jr., Republican, said in a press release that he's been, quote, strongly advocating to remove barriers that allow the use of medical marijuana as an alternative to opioids because it will help patients reduce the number of highly addictive opioids in circulation, and ultimately it will save lives. Quote, we continue to be faced with the opioid epidemic that is devastating communities throughout our state. It's important we continue to do everything possible to address this issue from all sides, so I'm glad the Department of Health is taking this measure that will help high-risk patients as well as those that are struggling with or have overcome addiction. The move from the state health department reflects an evolving approach to marijuana in New York. The New York Democratic Party recently endorsed full marijuana legalization, for example, and Zucker, the health commissioner, said last month that, quote, the pros outweigh the cons when it comes to ending cannabis prohibition in the state. A report from his department will recommend full legalization, he added, but the date for its release has not been announced. Was this today? Okay, so this article was published yesterday, and then today is when I believe. Yep. Today is when they dropped the recommendation, which is good because Cuomo, who is facing a primary challenge from pro-legalization actress Cynthia Nixon, encouraged banks to begin working with medical marijuana and hemp businesses. That was like last week. All right, so that's all your pertinent information about this emergency rule. Now remember, New York, when we look at the Americans for Safe Access scorecard for New York's medical marijuana program, they gave them a C+. And remember, nobody got an A. And the people that got B+, I downgraded them a little bit. And New York, I would not give them a C+ for one main big reason: no smoking. And another reason, home cultivation, no. So what can you do? Well, the conditions before today's emergency rule already had a bunch of stuff on there that you might have got prescribed opioids for, like cancer, ALS was on there, chronic pain, epilepsy, HIV, AIDS, Huntington's disease, inflammatory bowel disease, Parkinson's, post-traumatic stress disorder, multiple sclerosis, neuropathies, opioid substitution, and spinal cord damage. Was this updated today? It doesn't say. But anyway, I don't know if that was on there before today, the opioid substitution. But that, now that we know that can be on there or whatever, anything that has to do with opioids pretty much. But the limits are: the law permits qualified patients to possess a 30-day supply of cannabis-infused, non-smokable products, but only non-smokable preparations allowed. Regulations announced by the Department of Health in 2017 states registered organizations will be allowed to manufacture and distribute additional products, including topicals such as lotions, ointments, and patches, as well as solid and semi-solid products, including chewable and effervescent tablets and lozenges. Certain non-smokable forms of ground plant material will be permissible for manufacture and distribution. And I believe that's vaporized, stuff you can vaporize. But what I don't understand is how you couldn't just roll that into a paper and smoke it. I don't know if that's even what that is. I think that's what it is in Pennsylvania. I don't think you can vaporize in New York, or they don't sell that kind of medical marijuana product there. And they only have 25 dispensaries, so that's pretty bad. So in other news, and this is by Tom Angel, Cuomo administration report backs marijuana legalization in New York. The administration of New York Governor Andrew Cuomo, who until recently referred to marijuana as a gateway drug, and released a state health department report on Friday that says the positive effect of legalization outweigh the potential negative impacts. I hate I mean, the rhetoric, the goalposts have moved and the rhetoric has shifted. Now we're talking about, I get a lot of these, prohibitionists talking about things, and I hear what they're saying. And this is the new thing they're saying: potential negative impacts or potential harms or potential the word potential is the new thing that they add to everything, because we always say, well, what is these negative impacts? And since they said the word potential, then they can go and say all this conflated reefer madness crap that they always roll out. And it's like, no, that stuff's, you don't have any science, just like we don't have any science. You don't have any science to make those claims. So what are you talking about? And well, potential. Potential is just a buzzword that you use for something that might not ever even be. It's just a hypothetical, a straw man, whatever you want to call it. Anyway, so Cuomo to me still uses the language of prohibition, because right now that's where the goalposts are with the rhetoric that prohibitionists use. They know they don't want to do the uncomfortable thing of having to pull up some NIDA study from 1984. So instead, they're just like, oh, I said potential, eh? And no, we're not scared. No one's scared. Numerous New York State agencies are and subject matter experts in the field of public health, mental health, substance use, public safety, transportation, and economics worked in developing this assessment. The 75-page document says, quote, no insurmountable obstacles to regulation of marijuana were raised. Quote, regulation of marijuana benefits public health by enabling government oversight of the production, testing, labeling, distribution, and sale of marijuana. The creation of a regulated marijuana program would enable New York State to better control licensing, ensure quality control and consumer protection, and set age and quantity restrictions. The report estimates that legal marijuana sales could generate between $248.1 million and $677.7 million in revenues for the state in the first year, depending on tax and usage rates. Cuomo first announced the state legalization study during his annual budget address in January. At a press conference on Friday, he said that he had not yet reviewed the new report. The release of the pro-legalization state document is the latest in a series of cannabis moves the Cuomo administration has made since actress Cynthia Nixon, who was campaigning on the anti-prohibition platform, announced a primary challenge against the incumbent. And I can't stress and emphasize how important it is for progressive candidates like Cynthia Nixon to keep running in these elections, whether they have a chance or not. Because it forces the incumbent person to take a stance on an issue or to act on an issue, quite frankly. That's what he's doing. He's not just saying, well, I'm for legalization too, even though he never has been. Like he said that New York is leading the most progressive state there is on the issue. It's like, what are you talking about? Are you did you bump your head? There's states that have been selling legalized marijuana since 2014, right? So I don't know what he's talking about there. But yeah, thank you, Cynthia Nixon, for running against this pretty much prohibitionist. And he still is. He's just dragging his feet and kicking and screaming all the way into this. But thank you for pushing him into action, because that's what this is. The election today or tomorrow, and it's not just this issue, it's other issues that she's forced him to, take a a position that basically the public is more behind, whereas a corporate Democrat like Cuomo basically could just sit there and not even really do anything but spew platitudes, talk about the opponent on the Republican side, like do smear campaigns. That's what he's good at. That's what, he's got the name recognition and the clout to basically do those kind of tactics and win the general. So you gotta challenge people like that in their own party. You gotta make them do what the people want before they even try to get reelected by running against somebody like a Republican who's definitely just looking out for the corporations in Wall Street. Anyway, let me try to get through this end of this clip here. On Thursday, for example, the health department enacted emergency rules allowing the use of medical cannabis for any condition that would normally be prescribed opioids. But like I said, without smoking, and the program is really, really small. New York's one of the most populated things on the planet, and they got 25 dispensaries. Come on. But since they're only dispensing a bunch of topical solutions, and I don't even know if you can buy vapable marijuana, you definitely can't buy buds and smoke it. So I don't see them getting. That's not a good program. It's just not success. Success is not a part of the business plan of those dispensaries, apparently. Um, and then we heard about the banking, and also this report comes with the potential for substantial tax revenue, which can be used to help support program initiatives in areas such as public health, education, transportation, research, law enforcement, and workforce development. Wow, I mean, I'm just like anybody else. Sure, tax weed if you want, but come on, man. What is the deal with trying to make weed pay for every damn thing under the sun? What's weed got to do with transportation, education? I'm sorry, public health? Weed don't cause any public health problems. Research, law enforcement? Why does legalizing marijuana ever have to give money to the cops? We're taking a big burden off of them. Doesn't make any sense. Workforce development? I don't know. Anyway, the document notes that cannabis criminalization has historically disproportionately impacted communities of color, and that ending prohibition will address this important social justice issue. An issue that the New York Police Department, New York City Police Department, and Governor de Blasio, Mayor de Blasio will not, they won't acknowledge that. I mean, they will, but they won't through policy. They won't through action. The police union won't acknowledge it at all, even though their own reports are what we use to prove it. Anyway, with stop and frisk, we know, man. Quinnipiac poll released in May found that 63% of New York voters and 71% of the state's Democrats support marijuana legalization. Also in May, the Democratic Party of New York adopted a resolution endorsing cannabis legalization in its convention. Like many other Democratic state parties, it would behoove the actual Democratic Party to do something bold, I would think. Anyway, back to the article, the statewide push for legalization comes shortly after local cannabis enforcement reforms were announced in New York City. Mayor Bill de Blasio, Democrat, ordered the New York Police Department to stop arresting people for smoking marijuana in public, and several borough district attorneys have said they will stop prosecuting such cases. But de Blasio has so far refused to endorse legalization. Meanwhile, New York's two Democratic U.S. Senators, Chucky the Schumer and Christine Gillibrand, support ending cannabis prohibition and are sponsoring congressional legislation to remove federal impediments to state reforms. So, pat on the back to you guys. Some of the bulleted points included in the Health Department's new cannabis report are: regulating marijuana reduces risks and improves quality control and consumer protection. Marijuana may reduce opioid deaths and opioid prescribing. I think that one is, the jury's no longer out on that one, man. The majority of credible evidence suggests legalization of marijuana has no or minimal impact on use by youth. Legalizing marijuana results in the reduction of the use of synthetic cannabinoids, novel psychoactive substances. They're not so novel when you find yourself in the emergency room from doing that fake weed shit. So let's just say, whether marijuana is legal or not, and everybody should just avoid that shit like the plague. All right? They put rat poison in that stuff. Anyway, criminalization of marijuana has not curbed marijuana use despite the commitment of significant law enforcement resources. Haha, you think? We've had a prohibition on marijuana for 80 plus years, and now look, what has it done? Has it done anything? I mean, one of the side effects of that was the Mexican drug cartels rose to power and became like the most vicious thing in the world, churning Mexico into a straight up war zone, and basically most of South America with it. Anyway, back to the list. Marijuana prohibition results in a disproportionate criminalization of certain racial and ethnic groups, and don't forget certain actual political groups that are enemies of the police for some reason the state don't like, from war protesters to Black Lives Matter. Marijuana has been used to just basically railroad anybody that the system doesn't like, because they figure that, hey, these guys must smoke weed, because how else would they have thought that the system was rigged? Back to the list, there has been no increase in violent crime or property crime rates around medical marijuana dispensaries. We have studies for everything that they're saying on this list, by the way. And Chris Christie and all the prohibitionists that talk shit about what legalization might do, they don't have any studies to back up any of their fucking scary scenarios. Just keep that in mind at all times. And this one about the dispensaries, I've seen at least 4 studies about that. Marijuana regulation could generate long-term cost savings. You think? Regulated marijuana generates tax revenue. Of course it does. Legalization provides an opportunity to educate consumers on what their options are and encourage the use of products with lower doses of THC. I don't know what the fuck they're talking about there, but whatever. All right, Cuomo. Looks like, yeah, here you go, buddy. Passing the joint back to you. So that's what's going on in New York. Remember, they're offering medical marijuana instead of opioids. Maybe you guys should get some grassroots thing or something, or write your state reps. Tell them to do something about this shitty marijuana program you guys got, this medical marijuana program. I give it a grade of E or F or I. How about I for incomplete, because you don't allow people to grow their own cannabis. That just doesn't even make sense. And then B, no smoking allowed. That is just absurd too. All these no smoking medical marijuana laws, they got to go. All right, they're from coast to coast, and they just got to go. We're sick of them. They don't make any. It doesn't make any sense to tell somebody that smoking joints is not medicine. Just tell that to David Brill. All right, I'm out of here. Peace.